and welcome to Chapter 14, the last chapter in this course, which is the future of the U.S. healthcare delivery system. And what I want to leave you with, after all of the ground that we have covered in this course, from insurance to payment to financing to delivery, what I really want you to have a sense of is that the U.S. healthcare system, in as much as it is a system, but let's call it the U.S. healthcare industry, all of the businesses and all of the supports and all of the personnel that go into allowing for the delivery and the provision of healthcare in the United States is going to continue to, at a very rapid pace, change dramatically in terms of all of the quad functions. And what we know for sure is that change is going to continue to happen. And what those changes will be remains very much uncertain. A lot of the concepts that we have discussed in this class, such as community-based primary care, patient-centered medical homes, even value-based purchasing, are things that are still very much in the experimental hypothesis testing phase. We do not know, in fact, what is going to happen when we convert not just a very small subset of commercial reimbursement and the Medicare population to value-based purchasing, but as we move through 2016, 2017 to 2018 to having all reimbursement done on a value-based model, whether or not, in fact, this will improve quality and improve outcomes and ultimately reduce cost. We know it will reduce spending in some areas, but ultimately, will value-based purchasing be the initiative to help the United States bend the cost curve? There are a lot of really smart people who say yes, but it's not a total lock. We're not 100% sure that this is going to work, any more than we were sure that managed care would work in the 1970s or capitation was going to work in the 1980s. We didn't know, but we had a hunch that maybe some of these programs and some of these new philosophies could work to change and modernize and revolutionize the healthcare system. It's no doubt that it changed them. There's no doubt that it revolutionized them. But ultimately, in terms of the two primary goals that we saw, which was to reduce the cost of care or healthcare spending in the United States and to improve quality, managed care at least wasn't very successful in that. So it remains to be seen whether value-based purchasing, the new buzzword in the healthcare industry, will work better than managed care and other previous approaches at cost containment have in the past. What we also have to consider is that, of course, as we've talked about in every single week and in every single lecture in this course, the Affordable Care Act and the provisions contained in it is going to continue to make changes and push and drive innovation in the healthcare industry. It's been funding and driving innovation in health IT. It's been funding and driving innovation in care delivery models. It's been funding and driving innovation in medical education for nurses, for physicians, for allied health professionals. It has created the motivation and the incentives for change across the industry. Now, of course, the big question is, we have a presidential election in a little bit over a year. Will the Affordable Care Act remain if a Republican is elected in the United States to the office of the president in 2016? We don't know. Will some provisions stay in place? The answer is probably yes. Most analysts think that it is unlikely that the pre-existing condition provision would be removed because it is so wildly popular amongst Americans. But whether or not there would be an individual mandate to buy health insurance, whether that would be something that would be retained, I think is very doubtful if the Affordable Care Act is overturned. And it remains to be seen whether or not, in fact, depending on who the presidential nominees are and ultimately who the new president is, whether or not a single payer system is more likely, whether we'll see further consolidation in the health insurance industries that ultimately results in having a single payer, whether in fact we will move back to a less government-focused, more decentralized model, focusing more on industry. We don't know which of those things is going to come to pass, but this is why I would really encourage you as students of healthcare administration programs and as future leaders in the healthcare field that you continue to read current events. You continue to read magazines and journals like Modern Healthcare, like Kaiser Health News, to keep your finger on the pulse. Even reading things like the New York Times or the Washington Post or NPR will keep you abreast of what is happening in terms of health policy and health politics, such that you can be prepared and see coming some of the changes that are resulting from changes in policy and the political debates that are happening around healthcare in the United States. There's also one certainty that technological innovation is going to continue to drive healthcare. We know that we are a society that is driven by the technological imperative, that we always want to have the newest and biggest and best technology possible. And so as a result of that, we are guaranteed that we are going to continue to have significant innovations in the area of clinical treatment and care, in the area of personal genomics, in the areas of transplantation. All of these major areas in medicine are going to continue to see advances due to medical research and medical technology. What remains to be seen and is still unknown is whether or not we will actually be able to move forward toward our national goals for health information operability. If we can, as a nation, find a way to make health information interoperable between various kinds of health systems, whether people, regardless of what state they live in or what health insurance plan they have or what hospital they go to, will be able to have health information that is transferable and portable and understandable by any health system or any medical record system or any provider in the country, is a great goal. But whether or not that will come to pass still is very much a questionable one. What we also know in terms of the U.S. healthcare system that is coming in the future is that we are going to have to renew our focus on primary care, locally delivered, basic preventive care. We are going to have to train more primary care providers. Most likely those are going to be physician extenders like APRNs, nurse practitioners, as well as physician assistants to help bridge this gap. We have a bottleneck in our medical education system. We will not be able to build new medical schools and get the medical residency programs in place fast enough to meet this demand. However, nursing schools will continue to proliferate and grow and expand, and so will physician assistant programs. And this will mean that there will be lots of opportunities for people to get into primary care, and as long as we've talked about in this class, the right incentives are in place to drive people to actually provide care where it's needed and to deal with these issues of maldistribution, we will see improvement in terms of primary care and hopefully, ultimately, health outcomes for these traditionally underserved populations that have had trouble with access to primary care. We also know that we need more primary care providers because not only do more people have access to health insurance now, we also know that more people are going to be covered not just on private insurance, but on the Medicaid program. And so what we know is going to be necessary is not just more providers, not more physician extenders of any kind, but specifically those that are willing to serve in medically underserved communities where there may be high levels of poverty, relatively low levels of health literacy, and relatively high disease burdens. People who are willing to care for Medicaid populations, people with chronic illness, and it's really going to mean that primary care providers are going to have to become much more, even than they have been to date, of generalists, that they're going to have to treat and care for a wide range of conditions, multiple chronic conditions, and to treat some of the most complex patients that we have in our healthcare system. So ultimately, there's a lot of uncertainty in the future of the U.S. healthcare system. And I would argue this is probably one of the times of the greatest uncertainty in the U.S. healthcare system. But there is one guarantee. And that guarantee is that the U.S. healthcare system, as an industry, as a business, is going to continue to grow. It is going to continue to increase in size. It's going to continue to increase in revenue. And what remains a question is whether or not what will it continue to increase in terms of profitability will also mean that we won't be able to bring costs down, or will we actually be able to have healthcare organizations that are profitable, that are successful, that are growing, but that are also providing care in a more efficient and effective manner. That's the holy grail for the U.S. healthcare system and the U.S. healthcare industry. And hopefully that is something that you are excited about playing some small or maybe really big part in terms of changing what is so necessary to be fixed, which has been our very complex, technologically savvy, in many ways wonderful, but also very fragmented and broken U.S. healthcare system. So I hope you've enjoyed this course. I hope you'll take these last few messages and really think about them and internalize them, because the U.S. healthcare system is a fascinating, complex, rapidly changing industry to be a part of. And I hope you're looking forward to continuing to be part of that industry or entering that industry, depending on where you are as part of your career. And I really hope that you've enjoyed this course and hearing about all of the components that make up our wonderful and complex U.S. healthcare system.